And we should also maybe just say, I'm just preempting a question that may come up as well, is on the, how does it work on the nutrition side? Because often people ask, again, when we do these talks, we always forget to actually explain how that side of it works. Very, very briefly, on the psychology side, there's the 90-day program for people which are either unable to travel to a program, or so we have patients in about 30 countries. We do something called a telephone treatment program, where you get a lot of those materials, but you work one-on-one by telephone. For people that have done a lot of stuff already on the psychology side, and it isn't appropriate to go into one of the more generic programs, we also do one-on-one sessions in a kind of standard format as well. On the nutrition side, maybe you just want to briefly just mention it.
Yeah, on the nutrition side, we can't quite package it quite as neatly, I suppose, in a sense. It is, you know, it's one-on-one work, first of all, because on the nutrition side, as you hopefully got some idea how complex it can be, you know, you have to look at every individual in their own right. But basically, you know, you get started by doing the initial consultation, which is a very thorough workup of looking at those 3 different levels, if you like, in terms of how you got ill. You really, you know, when I go into the first session, I want to come out of it having as good an understanding as I possibly can in that time of, you know, exactly what's going on for you, what were your predisposing factors, you know, what happened along the way, what has triggered things, what are your topmost symptoms now, because although we may want to start right from the foundations, but if your topmost symptom is that you can't sleep at the moment, then I believe it's definitely worth symptom managing that, you know, and there's, you know, things that we can do for that, whilst we then, you know, dig deep into the foundations and sort out all those sort of more solid cornerstones of the recovery. We use a set of GP blood tests we use a very extensive questionnaire, first of all, which can be quite a lot of work to fill in, but it's a great piece of information for me already before I even see you or speak to you. And then we have a set of GP blood tests that we get you to do with your GP, which doesn't cost anything. And surprisingly, the question always gets asked, do GPs do them? Yes.
Well, no, because I've got your
there you are.
the
exception.
I was going to ask you, I've been to my GP and I've said, here's a list of tests that they want. Well, I mean, maybe you'll think this is okay. The GP said, well, I think they're being very naughty here. No, I wouldn't authorise the whole set of those.
Yeah.
As it happens, we've done 8 of them.
Yeah.
Or there's 2 of them we haven't done.
Yeah.
So I wondered, was that obviously that data's old data? Is that any good?
Well, any data is good, and yes, I absolutely agree that we give our sort of best scenario wish list with that list. I think 9 out of 10 times we don't get absolutely every value that's on that list. We get a lot already, and that's, you know, that's usually good enough to get going.
I think often the thing is for GPs is that most GPs take the perspective that there's not a lot that they can do to help, and if you're being proactive in trying something else, they're often be as supportive as they can about it. Some GPs, it happens rarely, but every so often GP will say, nope, I'm not doing it. And if that happens, we have private labs you can go and pay, and it's not a huge amount of money to go and pay to get the tests. And you can change it. But without getting too political, but one thing that I do
Yeah.
One thing that I do always say, which is a little bit of a loaded comment, but that if your GP is, the best you can hope for often is a GP that's supportive and understands, but doesn't necessarily have things that they can do for you. If you don't have that, you fundamentally have the right to change GP. So if you feel like you're not getting support, and there may well be contacts through the group, they can put you in touch with GPs that will at least be able to, you know, one of the big difficulties for some patients is just getting their entitlement to their benefits, which make a massive difference in terms of being able to not have to push yourself into situations. So there's also organisations like Action for ME and the ME Association, which have done some great work in that area in terms of getting access to that kind of information. And it sounds like you've got some good stuff that's happening locally as well. So yeah, that's very, very briefly how it works in terms of the treatment side. There's a lot of information in the information pack as well. But what other questions have people got? Yeah. Sorry.
Tests are free through the GP, but then what about afterwards?
Yeah.
Supplements obviously are going to be costly.
Yeah.
Yeah. So basically, with the nutrition, where the cost comes from is obviously your sessions with your nutritionist, which actually, pardon? Which is the initial session is £215, which basically gets you hour and 45 minutes of our time. The hour is usually spent, you know, with with your practitioner, either face-to-face in London or on the phone. From my point of view, I don't think there is any difference really on the nutrition side, whether you come and see us face-to-face or whether we work on the phone. Some people might prefer to come for the first session so that they, we kind of know how each other looks, but we do always ask people to send a picture, and we've got our pictures on the website, because it just gives that more of a connection anyway. You know who you're dealing with. But then there's a lot of what you're obviously initially paying for as well is all that other time when we just literally sit and go through your notes, go through your questionnaire, go through your GP results, and really start sort of analysing it as well. And then going forward from there, the hourly rate for follow-up consultations is 125. Now, you get you pay for the time that you spend with your practitioner. So if we need a shorter catch-up, then you're not paying a sort of a flat hourly fee. We're actually pro-ratering it per minute of the time that we spend on your case. There's usually a little bit of admin time on top of the actual sort of face-to-face or, I don't know, ear-to-ear time that we have, because obviously we're putting together your supplement notes, etc. I tend to talk to my patients maybe every couple of months. So in terms of consultation time, it sort of spreads out. Obviously, as you say, there are usually extra nutrients and supplements that you need to take to really start making fundamental differences. What I would say is I'm certainly very used to working at very different paces, at very different budgets, because there's, again, we're not the sort of outfit, I don't think, that we try to say one size fits all, because it doesn't. It doesn't because of your symptoms and conditions and your triggers, but also it doesn't because of the pace at which you want to go, just the financial constraints that you may have, etc. So it's a two-way process. It's always, I always say, we both need to be in it. We both need to, discuss what's best. I will tell you what I would like to do in an ideal situation. I'm not going to withhold sort of information and say, well, I'm just not going to do that. But then we can say, okay, well, this is what I'd ideally do. We have other options. Shall we talk around it?
Are the supplements coming through you? Or
No, you buy them directly from people that sell the supplements. I think a couple of things also worth.
recommend to get the supplements from?
Varies completely on what we're treating. There's a whole range of different companies for different products, effectively. I think what is worth saying also about the pricing side is that, firstly, a lot of what you're paying for is not just what happens in the session, but we spend a lot of time in departmental meetings discussing cases. So if you're seeing, for example, Sana, and you've got a specific kind of complex of something that's happening that someone else in the nutrition team has treated a lot, those cases also get discussed within what we're doing. So a lot of what you're really getting is the expertise and the knowledge. For us to have the best practitioners in the country, basically when we recruit, the recruitment goes out to all of the graduates of the nutrition colleges. We basically hire the best people that are there. That to get the best people and to pay them well enough that they don't burn out doing the job and they can properly take care of themselves is expensive for us. To have really good admin people that properly take care of our patients, that can send out all the information packs, and we also, I should just briefly say before we go back to the questions, that we have a process where after you get the information pack, you have the option of a free 15-minute chat with either the nutrition team or the psychology team or both, where it's basically an opportunity for you to ask your specific questions based on your situation for us to see if we think that we're going to be the best people to help you. So it's not a sales thing, there's no obligation, it's literally just you ask your questions and we answer them. So there's quite a lot of, between that and all the stuff that's on the internet, there's a lot of opportunities before to get questions answered.